A hospital is a place where diversity is not just a concept but a daily reality. Picture yourself walking into a hospital ward, each room revealing a world of different cultures, languages, and beliefs. This is the stage where modern nursing unfolds, rich in diversity and human connection. Today we are going to immerse ourselves in the dynamic and challenging world of multicultural nursing. How do nurses successfully communicate and empathize with patients from various cultural backgrounds? How do we balance medical needs with cultural sensitivities? These are critical questions that shape the heart of nursing today. To understand how to deal with the multitude of multicultural nursing, we have to delve into Madeleine Leininger's groundbreaking theory, which revolutionized how nurses interact with patients in culturally diverse healthcare settings. Her insights provide a roadmap for nurses to navigate the complex maze of multicultural healthcare, ensuring every patient feels understood, respected, and cared for. As we move through our journey today, we'll uncover the real-world challenges we as nurses faces, the strategies we can employ, and the profound rewards we can experience in this multicultural tapestry. So stay tuned as we embark on this enlightened journey, unraveling the intricate layers of nursing across different cultures and communities. But before we start our journey, let me just say hello to my fellow healthcare warriors. I'm Martin, your Danish male nurse, as always here to share my passion for nursing with you. So let's kick off this journey by delving into Madeleine Leininger's transcultural nursing theory, a cornerstone in the multicultural nursing. Leininger's theory, also known as the theory of cultural care, diversity, and universality, emphasizes the understanding of cultures to provide care that is congruent with a patient's lifestyle, beliefs, and practices. Leininger, a nursing theorist and anthropologist, introduced this theory in the 1960s. She observed that cultural misunderstanding and ignorances were often at the root of inadequate patient care. Her theory proposes that nurses should not only be aware of their patient's background, but deeply understand the cultural backgrounds of the patients. This understanding enables nurses to provide care that is more effective, respectful, and tailored to the individual needs. And the essence of Leininger's theory lies in the concept of cultural competency. This means having the skills, knowledge, and attitudes to provide care that fits the patient's cultural values, beliefs, and practices. For nurses working in multicultural settings, this theory is a guiding light. It encourages them to learn about different cultures, respect cultural differences, and apply this knowledge to improve patient care. Applying Leininger's theory in practice involves understanding and respecting the diverse cultural backgrounds of patients, from dietary preferences and language barriers to religious practices and family dynamics. It's about creating a bridge between the nurse's professional knowledge and the patient's cultural background, and let that bridge lead to a more empathic, effective, and personalized care. I will in this episode cover some practical applications, so make sure that you stay tuned to find out how to use her theory out in the clinic. Madeleine Leininger's theory is not just a set of guidelines, it's a mindset. It urges nurses to see beyond the clinical aspects of their role and embrace the rich cultural dimensions of their patients' lives. As the nursing field continues to evolve in our increasingly diverse world, Leininger's insights remains more relevant than ever. In my journey as a nurse in multicultural settings, I've encountered numerous challenges that have both tested and enriched my professional and personal growth. One of the most significant challenges is communication. Language barriers are often making it difficult to understand and connect with patients, leading to potential misunderstandings. And it requires patience, creativity, and sometimes the assistance of translators or technologies such as Google Translate to bridge the gap. Another challenge is the diverse belief systems and practices around health and illnesses. I've learned that what is considered a standard medical practice in one culture might be completely foreign or even unacceptable in others. Navigating these differences while respecting each patient's beliefs is crucial, yet complex. It's about finding a balance between delivering evidence-based medical care and honoring cultural practices. Additionally, addressing different cultural attitudes towards healthcare professionals can be challenging. In some cultures, there is an immense respect for nurses and doctors, while in others, skepticism and reluctance to follow medical advice is more common. Understanding these attitudes and working to build trust is a vital part of my role. Moreover, the emotional toll of working in such diverse environments cannot be understated. Witnessing the health disparities and barriers to healthcare access faced by some cultural groups is often heart-wrenching. Yet it also fuels my commitment to providing culturally competent care. So working in a multicultural environment as a nurse is filled with challenges that demands adaptability, cultural sensitivity, and a deep commitment to patient-centered care. These experiences, though demanding, have been invaluable in shaping me into a more skilled and empathic healthcare professional. And it has taught me that we can still do good work in a high-paced environment without losing respect for the individual patient. So let's deal with the challenges by exploring how nurses can effectively apply cultural competency in their practice. Because cultural competency isn't just about being aware of cultural differences. It's about actively integrating this awareness into everyday nursing care. One key approach is active listening and, of course, an open communication. By actively listening to patients' concerns and questions, nurses can better understand their cultural perspectives. This can be particularly helpful in overcoming language barriers, using simple language, visual aids, and, when necessary, interpreter services can significantly enhance communication. And my favorite tool is Google Translate. It is not in any way perfect, but it has a dialogue feature that makes everyday communication possible. And it's in a way that lets us understand the patient and them to understand us. And if you want me to make a video on how I use it, then write it in the comments. Another aspect of cultural competency is respecting and incorporating patients' cultural practice into the care plans. This could mean accommodating dietary restrictions, understanding religious beliefs affecting treatment decisions, or recognizing the role of family in patient care. For instance, involving family members in discussions and decision-making can be crucial in some cultures, and in these cases it's all about talking with your patient about their beliefs and how they see the world, because your patient is an expert on their lifestyle. Education plays a pivotal role too. Regularly educate oneself about different cultures and their health beliefs and practices is essential for providing cultural sensitive care. This continued learning process helps nurses to anticipate and address specific needs of patients from diverse backgrounds. What I have done is to educate myself on the most common beliefs, so I know some part of the Bible and a bit about the Quran, and is still learning about both so I can better understand how to help my patients. Because Christians, Muslims and atheists are, the patients I get the most from a religious belief. From a cultural background, it's a bit broader than that. Moreover, advocating for patients' rights and needs, especially those facing healthcare disparities, is a fundamental part of cultural competency. This might involve navigating social services, providing additional support to access healthcare, or simply ensuring that all patients receive equal care and respect regardless of their cultural background. In essence, cultural competency in action means going beyond recognizing differences to actively and empathically engage with them. It's making each patient feel valued and understood, thus transforming the challenges of multicultural environments into opportunities for more compassionate and effective nursing. So let me ask you, what do you do to accommodate patients of different cultures? Leave your tips in the comment section and let's grow together. Reflecting on the challenges and the application of cultural competency in nursing, it becomes clear that working in a multicultural environment offers numerous benefits and opportunities, not just for personal growth, but also for professional growth. The diversity of patients I encounter enriches my nursing practice with a broader spectrum of perspectives and experiences. One of the most rewarding aspects is the deepened empathy and understanding I gain from different cultures. This not only enhances my nursing skills but also enriches my personal worldview. Every interaction with a patient from a different background is an opportunity to learn and grow, both as a nurse and as an individual, and as a person who wants to understand the world. Moreover, the ability to effectively communicate and connect with patients of various cultures is immensely gratifying. There's a unique sense of accomplishment in successfully bridging cultural gaps to provide the best possible care. It strengthens the bond between nurse and patient, leading to a more effective and satisfying healthcare experience. Additionally, the challenges of multicultural nursing fosters resilience and adaptability. Navigating language barriers, cultural nuances, and diverse health beliefs hones my problem-solving skills, making me a more versatile and competent nurse. And if you want to be a more competent nurse, then check out this video, specially picked for you. Yeah, it is actually just picked for you.